Asthma is a complex and chronic inflammatory disorder which is associated with airway hyperresponsiveness and tissue remodeling. Environmental factors play a major role in the etiology and pathophysiology of asthma. There are many sources of allergens. Such allergens can enter the lungs and induce cells of the immune system, such as mast cells, eosinophils, macrophages, and helper T cells, to release various signaling molecules. These immune cells can also release factors that stimulate an inflammatory response within the lungs and lead to excess mucus secretion and airway thickening. The release of such factors can promote the contraction of smooth muscle within the lungs, which leads to bronchoconstriction. Fluticasone formoterol MDI inhaler, Flutiform, has been developed for the treatment of both inflammation and bronchoconstriction in asthma. Its modern inhaler has a built-in, easy-to-read dose indicator contained within a compact, familiar aerosol device. In vitro data has shown that Flutiform delivers a consistent fine particle fraction of approximately 40% of emitted dose. Large particles are prone to deposit in the throat and mouth and are swallowed. Fine particles have greatest potential for deposition throughout the lung. Formoterol, the bronchodilator found within Flutiform, is a selective, high-affinity, long-acting beta-2 adrenoceptor agonist. It is fast-acting and causes bronchodilation within 1 to 3 minutes. Comparative studies have shown that formoterol acts more rapidly than salmeterol, another long-acting inhaled bronchodilator, a favorable effect given that a rapid bronchodilatory action may facilitate patient adherence to their maintenance therapy. Fluticasone, the corticosteroid component of Flutiform, powerfully dampens inflammation. It mediates its effects by binding to glucocorticoid receptors within cells. This leads to a decrease in the release of inflammatory mediators from immune cells. Fluticasone is the most potent corticosteroid available in a single inhaler combination, with sustained anti-inflammatory effects. Fluticasone has a wealth of evidence supporting its effectiveness for the treatment of asthma, and it is the most frequently prescribed inhaled corticosteroid in Europe for treating respiratory disease. In vitro models have shown that the combined use of long-acting beta-2 agonists and inhaled corticosteroids, such as formoterol and fluticasone, have synergistic effects. Studies have shown that formoterol can enhance the activity of glucocorticoid receptors, the primary target of fluticasone. And inhaled corticosteroids can increase the density of beta-2 adrenoceptor, the primary target of formoterol. Furthermore, recent in vitro research has shown that fluticasone and formoterol have beneficial synergistic effects on cell proliferation in asthmatic smooth muscle cells. For asthma maintenance, Flutiform brings together the rapid onset of formoterol and the potent anti-inflammatory effects of fluticasone in a device that emits a high fine particle fraction and provides long-lasting clinical efficacy.